All right, we're now going to talk about Chapter 64, care of patients with male reproductive problems, particularly the prostate gland with cancer and also benign prostatic hyperplasia. All right, hold on a minute. All right, so the concepts in this chapter are going to be elimination, cellular regulation, infection, and interrelated is going to be sexuality and reproduction. Okay. All right, so when we're talking about elimination concepts of BPH, they experience glandular changes due to increased age and increased dihydrotestosterone. This causes the nodular tissue to grow excessively, called hyperplasia. It's the increase in the number of cells that cause an abnormal growth of the tissue. As that prostate gland enlarges, it grows upward and inward into the bladder, and it causes obstruction because it's putting obstruction on the urethra or pressure. The obstructed elimination can cause lower urinary tract symptoms, which include urinary retention, urinary leaking, incontinence, and also infection. Okay. All right, so BPH grows inward, remember that, causing narrowing of that urethra. The detrusor muscle, which contracts the bladder, thickens to help urine pass, but the urinary stasis persists. This causes chronic urinary retention, bladder calculi or stones, infections, a hydroureter, and hydronephrosis. Okay, so you see the risk factors, both modifiable and non-modifiable. Remember that African Americans under 65 is the most common. Asian men less likely to need surgery than Black or Caucasian. Also genetic susceptibility. They have the GATA3 variants or a family history. The modifiable risk factors are that obesity and that metabolic syndrome, that blood sugar, that blood pressure, that cholesterol level, and that waist circumference. Also excessive caffeine or low levels of activity, but these are modifiable. So you need to teach that patient that BPH is common, and addressing those modifiable risk factors can improve their overall health. All right, as far as the assessment, it talks about the International Prostate Symptom Score. It's scored 1 to 7 if it's mild, 8 to 19 for moderate, and 12 to 35 for severe. They'll have presentation of difficulty starting and maintaining a urine stream. That is one of the hallmark symptoms of BPH. Patients need to avoid before a physical exam. They may feel the urge to urinate during the exam. The exam is done by digital rectal examination where they'll bend over a table or a sideline position. BPH presents as uniform, elastic, non-tender enlargement. If it's cancer of the prostate, it'll feel like stones, hard nodules. After the prostate gland is palpated, it may be massaged to obtain fluid samples to rule out prostatitis or inflammation of that prostate. Oops. All right, so remember the psychosocial assessment. This can cause frustration or depression due to sleep interruption and also embarrassment because of the incontinence. As far as diagnostic assessments, they can do a UA and culture to find out if it's an infection, a CBC for systemic infections and anemia. The BUN and the creatinine, usually both will be elevated, and the PSA will be positive with a prostate-specific antigen, and the serum acid phosphatase will be elevated if there's any metastasis. So as far as interventions, you need to teach to avoid drinking large amounts of fluid in a short time. They need to limit their caffeine and alcohol, avoid anticholinergics, antihistamines, antipsychotics, and muscle relaxants. Drug therapy will be with alpha blockers because they relax the smooth muscle in the bladder neck. Also, alpha reductase inhibitors. They reduce prostate size, and they're most effective when they're given in combination. Also, the herbal supplement Sal palmetto. That can be bought over the counter. It has a long list of drug interactions, though, so you need to warn the patient about these to consult with the doctor before they take them. And as far as surgical procedures, they can do a prostate artery immobilization. They'll go in through the wrist or the groin. They inject particles to reduce the prostate gland size. And then you've got the transurethral resection of the prostate. That's where they'll remove an enlarged part of the prostate endoscopically. And remember, they're going to have that three-way bladder irrigation catheter in place. And you need to know that solution. You need to maintain aseptic technique. The purpose of that irrigation catheter is to remove clots. You only want to see small clots with pinkish urine. You do not want to see large clots with bright red or burgundy urine. If these occur, you got to notify the doctor. All right, as far as the TURP postoperative care, it is normal to see small blood clots and pink tinged drainage, but urine that is bright red ketchup-like or has large clots is an indication of bleeding and should be reported immediately. Then it talks about a med called tamsulosin. This is an alpha-adrenergic antagonist that treats BPH given by mouth. It interacts, though, with other alpha blockers, and it can cause dizziness and drowsiness, AFib, back pain, decreased libido, and respiratory impairment. You give this drug 30 minutes after the same meal each day, usually dinner, and do not crush or chew or open the capsule, and teach the patient to change position slowly because of the orthostatic hypotension. Then we get into prostate cancer. It's a slow-growing cancer with predictable metastasis, and advanced age is the leading causative factor. Okay. And then it talks about the etiology and genetic risk. Remember, the big risk is advanced age, also first-degree relative. Unfortunately, African American men. It's most commonly diagnosed as non-skin cancer in men in the U.S. Has nearly 100% cure rate if you get it early, and men greater than 65 are at the greatest risk. All right, so remember, nutritional habits. You should teach that patient to decrease intake of animal fat and dairy products, and they should increase their fruits and vegetables, especially tomatoes. As far as the assessment, we want to look for gross blood in the urine. This is a sign of late prostate cancer. Unexpected weight loss is also a late sign. So either of the two. So the laboratory assessment, they can do a PSA. It's not specifically a diagnostic for cancer because other conditions can cause elevations. If it's done, it should be drawn before any DRE or truss procedure is taking place. Under 50, the PSA should be less than 2.4 nanograms in a milliliter, and over 50, it should be under 6.5. The transrectal ultrasound, the truss, lidocaine is given topically and injected directly into the prostate. If cancer is suspected, a biopsy will be done during the procedure. As far as interventions, active surveillance, prostate cancers, remember, are slow growing, so you need to monitor without immediate active treatment, and they need a predefined follow-up schedule with regular intervals. As far as drug therapy, it's going to be with chemo and hormone therapy. Radiopharmaceuticals are reserved to treat cancer that has spread and has been previously treated with hormone therapy or chemotherapy. The side effects include low blood count and kidney damage. Then there's the brachytherapy, the intensity modulated radiation therapy, targeted to deliver directly to the prostate, or the stereostatic body radiation therapy. Large doses are given directly to the prostate, and there's a shorter treatment time, but there's more side effects. Okay, as far as interventions, you see them here. Nursing care is the same for any patient under surgery. Manage the pain. They'll have an indwelling catheter and ambulate them no later than the day after surgery. They may end up with erectile dysfunction or urge incontinence. All right, then it goes into testicular cancer. This is a rare cancer affecting men. Average age of diagnosis is 33. 95% cure rate if it's detected early by testicular self-exam. There's different types of tumors. You've got the germ cell tumor versus others. They're the more common in clients who have a family history of testicular cancer, and sperm might be absent or low in number but remain viable after diagnosis. Okay, as far as the testicular cancer assessment, you got to consider risk factors. They're going to present with a painless hard swelling or enlargement of the testicle. It's usually only on one side. They'll report this dragging or heaviness. You need to assess for concerns of sexuality and reproduction, and the healthcare provider will perform the testicular exam. And then you've got the lab tests, the alpha-fetoprotein, the human chorionic gonadotropin, and the lactase dehydrogenases. Other diagnostic assessments would be a scrotal ultrasound, chest x-ray, CT of the abdomen and chest and pelvis, or an MRI of the brain to check for metastasis. So if before any surgical procedure, the patient can have sperm bank storage. Non-surgical management would be chemo or radiation, whereas surgical would be an orchiectomy, removal of the testicle. Testicular exam, the nurse should inform the adolescents to perform a testicular self-exam monthly. Inform them to gently roll the testicle to feel for lumps, swelling, and tenderness. The nurse should inform the adolescent to perform testicular self-exams when the scrotal skin is relaxed after a warm shower at the same time every month. They need to report any lumps or swelling immediately to the MD. Then it goes into talking about erectile dysfunction. Remember, there's two types. There's the organic, which causes a gradual reduction in function, versus the functional. And functional is caused by high stress. Remember, it's the parasympathetic nervous system that activates orgasms and the blood flow to the penis. So if the sympathetic, which is on during the stressful situations, then you don't get that parasympathetic involvement. All right, so then it talks about interventions. It says making lifestyle modifications, management of meds that can cause erectile dysfunction. They can get penile self-injections with prostaglandin E1, drug therapy, psychotherapy. They could have surgery or maybe a vacuum-assisted erection device put in place. And then you have a question. The answer here is going to be D. So the nurse caring for a client who had a TURP, which assessment finding requires immediate nursing intervention, bleeding from the surgical site. Okay, remember, the patient may be at high risk for pain, infection, and bladder spasms after a TURP, but the highest risk is that hemorrhage. So you need to assess for postoperative bleeding. Patients who undergo the procedure or have an open prostatectomy are at risk for severe bleeding or hemorrhage after the surgery. Although rare, bleeding is most likely to occur within the first 24 hours. So blood transfusions are commonly given after a TURP surgery, but not needed after the other procedure, the LEAP procedure. The bladder spasms or movement may trigger fresh bleeding from previously controlled vessels. And this bleeding may be either arterial or venous, but the venous bleeding is the most common. Next question here. It says a nurse is caring for a client who has just been described sildenafil for erectile dysfunction. Which teaching will the nurse provide? Remember, that's going to cause severe orthostatic hypotension, so it's B, be cautious when standing up quickly. Phosphodiesterase 5 inhibitors can lower blood pressure, so you got to teach them to use caution when standing up quickly. This drug comes in a pill form, must be taken about 15 minutes before intercourse, and should not be taken with grapefruit juice. Now, that concludes the lectures for this week. I do want to add the topics that you need to study for your upcoming quiz. And that would be abnormal urinary output, including terminologies and amount, a 24-hour urine collection procedure, the types of incontinence and the things associated, what causes the incontinence, the risk factors for incontinence, cystitis, including symptoms, manifestations, and treatments, the following meds: vancomycin, ciprofloxacin, phenazopyridine, and oxybutynin, the conditions of pyelonephritis, acute versus chronic glomerulonephritis, nephrotic syndrome, foods that are high in potassium, polycystic kidney disease, acute kidney injury, interventions after a kidney biopsy, functions of the kidneys, and signs and symptoms of bladder cancer. Hopefully you guys have a good Thanksgiving, but remember to study up, get this last quiz knocked out. Have a nice weekend, and I'll see you next week.